is gonna be going superior, anterior, and laterally towards what structure? Eyeball. So superior, anterior, and lateral. And if we do a down glide, we are pushing it the opposite. So inferior, medial, and posterior. And that's exactly what we're gonna do right now. We can't do that on the spinous process because those two motions happen simultaneously. They both go up, they both go down. So here, we're just gonna get on one articular pillar. You can fix some. You're good. So if she has a problem looking to the right, what happens on the left? Opens. What happens on the right? So mechanically, and this is actually for treatment wise, this is a mulligan technique, so we're gonna be doing this later. But you can also just use this as a quick assessment as well. So you're gonna get on whatever articular pillar on the top segment. So let's just say this is 4, and we'll say this is 5. I'm gonna get on the articular pillar of 4. And when she turns her, so say she's limited turning to the right, we're going to then, when you turn, I'm gonna put some pressure here. I'm gonna be pushing superior, anterior, lateral towards her eyeball. Because remember, when she moves, the joint plane changes. So I need to go with her. And go ahead. And then we just move that joint space. And if it works, I know it's an opening problem on the left. Say it doesn't work, what should I do? I'm gonna go to the segment below on the other side. Why the segment below?
Does this say it's open?
Push it up for closing. Because if I push the same segment up, I am closing the area above her injury, so that doesn't work out too well. So I'm gonna go to the area below, push, turn your head, pushing up and in, see how it goes. And that's it. Relative movement. Because I need to know, is it an opening problem? Should I be focusing on flexion techniques? Or is it a closing problem? Should I be doing extension techniques? And if I do the opposite technique where I'm supposed to, are they gonna get better? No, specificity. This just helps to guide our treatment. That's all it is. Oh, that's a lot of stuff.
Can you repeat the directions? Superior,
Anterior, lateral,
anterior, lateral.
inferior, medial, posterior. We're gonna get to it later, but when we get to the interventions, you'll see that terminology. All it's telling you is the direction of the facets. So,
Is this a biomechanical correction or?
yes. If you do it as an intervention with a 2-second hold 10 times, it's a mulligan technique called a snag. Sustained neuropophyseal glide.
Is that what the towel thing is?
That is a self-snag. Mulligan technique, yeah.
Interesting.
That'll be in your mulligan book.
The bottom segment, you said that's going the posterior inferior.
Relative motion.
Yeah,
So,
but that's why you go to.
because if I push the bottom segment, superior, anterior, and laterally, that's a relative inferior, medial, posterior of the top segment. And what's our reference segment?
Superior.
Top. So that's why even if I'm pushing superior, anterior, lateral, if I'm on the bottom segment, I'm referencing the top. It's a relative imp. Inferior, medial, posterior. Saying that the facets are at a 45-degree angle towards the eyeball. A lot easier to remember. I heard